Good evening, ladies and gentlemen. This is Dr. Paul. Once again, welcome to our videos at www.usmlevideos.net. Tonight, I want to talk a few minutes about iron deficiency anemia. Iron deficiency anemia is the most common anemia in the world. Now, let me make it clear. This is a very important topic for USMLE examination. And you need to know these facts very well in order to answer the questions appropriately. So let us start today. Iron deficiency anemia is the most common anemia in the world, and the most common cause of iron deficiency anemia is blood loss. Whenever an elderly patient comes and complains of fatigue, palpitations, and you took his blood and you saw some hypochromic microcytic anemia or low serum iron levels, then you should suspect iron deficiency anemia and blood loss somewhere in his gut or some other place. He or she is losing the blood. This fact must be borne in your mind. Now, total body iron stores is approximately 2 to 4 grams. Now, the daily requirement changes. It varies between man and woman. In men, it is approximately 7 milligrams per day. That is the recommended daily intake of iron. In women, especially who are in the menstruation, it is 12 to 16 milligrams, whereas in postmenopausal women, it is approximately 5 to 7 milligrams. You see, women who are in menstruating, they lose almost like 50 milliliters of blood in their menstruation, and that carries lot of iron. So these women are very prone to iron deficiency anemia. And also women who are pregnant, in pregnancy, the demand for iron increases tremendously, like more like 2 to 5 milligrams more than the regular. That's why we should always replenish a pregnant patient with iron and folic acid. Now let me talk a few minutes now about symptoms and signs. Easy fatigability, that's number one. Then dizziness, headaches, weakness, and tachycardia, palpitations, tachypnea on exertion, a smooth tongue. Iron deficiency causes atrophic glossitis, and that produces a smooth tongue. And spoon nails, that is also known as chylonychia, and the brittle nails, chelosis, the angles of the mouth being inflamed, and also the angular stomatitis. Then pagophagia or pica, that is this abnormal desire for eating some kind of mud or some non-nutritious material. These people also would like to chew a lot of ice cubes or cold food. So this is known as pagophagia or pica, which is very normal in iron deficiency anemia. Now let us talk about diagnosis. Very important. You should know what increases and what decreases in iron deficiency anemia. First of all, let us see what decreases. There will be low serum ferritin, less than 12 mcg per liter. So low serum ferritin, low serum iron, and low percent iron saturation, low MCV. Those are the most important lows. Now high total iron binding capacity, TIBC, is elevated in iron deficiency anemia. And don't get confused at that point. TIBC is elevated, it's not decreased. And if you put decreased, that would become the dumbest answer in the world, because in TIBC is always elevated in iron deficiency anemia. Then low percent iron saturation. So iron saturation decreases, total iron binding capacity increases, platelet count increases. And what type of anemia? Hypochromic microcytic anemia. And you can also see anisocytosis, that is variation in red blood cell size. If size changes, it is anisocytosis. And poikilocytosis, that is variation in shape of red blood cells, that is poikilocytosis. And the other thing is, when you give these patients oral iron therapy, they respond with increased reticulocytosis, that blood forming cells, they increase erythropoiesis, and there will be a lot of baby RBC, those are reticulocytes. And so those are the most important things we need to remember in diagnosis. And whenever there is doubt for diagnosis, the gold standard is bone marrow examination and finding low serum iron levels and low iron stores in the marrow. That is the gold standard for iron deficiency anemia. Then treatment, oral treatment and parenteral treatment. Most commonly it's oral treatment. We use ferrous sulfate, 325 milligrams tablets, like 3 times a day to start with. Or you can also start with one tablet in patients who cannot tolerate it. And patients are advised to take it with food. The most common side effects are gastric irritation and constipation. Because these patients get constipation so frequently, we also give them stool softeners. And the other thing is acidic environment, it improves the absorption of iron. That's why we also give them ascorbic acid, vitamin C, along with iron tablets. Then parenteral therapy. In patients who cannot take oral iron therapy, iron dextran or sodium ferric gluconate, these are the agents that could be given parenterally. But remember, the most important thing is these parenteral iron forms can give you fatal anaphylactic reactions. These are they could kill the patient. That's why parenteral therapy is limited to patients who cannot take oral therapy. Now let us go through most important points. Most common anemia around the world, iron deficiency anemia. Iron requirements during pregnancy and lactation, 2 to 5 milligrams per day. What is the most important cause of iron deficiency anemia? Blood loss. And what is the Plummer-Vinson syndrome? That is esophageal VAPS due to iron deficiency anemia causing dysphagia in the patient. That is PV syndrome. Very, very important. Esophageal VAPS, dysphagia, iron deficiency anemia. Then what is the risk associated with PV syndrome? There is the increased incidence of esophageal cancer in these patients. Then why do vegetarians have higher incidence of iron deficiency anemia? You see, heme iron is absorbed more than non-heme iron, which is in vegetables. Heme iron is in the meat. So when we eat meat, we get better source of iron. Then let us see a sample scenario. 67-year-old female came to your practice and she is complaining of easy fatigability, dizziness, headaches and palpitations, and not able to concentrate on things. And you did a peripheral smear, you saw microcytic anemia and low serum iron level, high TIBC, high platelet count. What do you suspect? You suspect iron deficiency anemia. And that does not stop there. You should check for the source of blood loss in that patient. So those are the most important points I wanted to share with you tonight. And always visit us at www.usmlevideos.net. That is www.usmlevideos.net, where you can browse through hundreds of videos. Thank you. Have a nice day.